Excellent. Okay. So today, I wanted to just welcome you all. Again, thanks so much for coming. We're always so glad to have you join us and take time out of your busy mornings to be with us. This morning, we have some special guests joining us from the Migrant Education Program, not only from OSPI, but we have Armando. I believe Armando is going to be joining us for the program. But we also have Maria Navarrete from here at the ESD. She's our migrant out-of-school youth and health ed coordinator here at the ESD. And we also have Blanca Salgado, who is a migrant nurse case manager with the Eastmont School District. And she's going to be discussing with us some of her experiences. And then we will hear from Dr. Wallace. And then we'll hear from Kathy with some health updates and some regional nurse and state nurse updates for Kathy. So as always, just wanted to remind you that, going back to our meeting objectives is to better understand the migrant education program and how we can support our migrant students. And then the goals for the meeting is to be able to identify 2 supports that you can utilize in your practice to help with your students with migrant programs, or sorry, students that are of migrant status. And then I have the framework there because I think everybody gets a little bit of different takeaways from the meetings. So I just wanted to make sure you have the framework in mind as we go through our meeting and what pillars from this framework that you can utilize in your practice. And then as always, please remember to keep your microphones muted and feel free to raise your hand or drop a comment in the chat if you have anything that you'd like to add or ask. And a reminder about the clock hours, that in order to receive those, that you need to either attend this live session or be watching the recording. So hi if you're watching the recording, and then fill out the attendance survey, and then there's the PD enroller survey, and then there's the payment for the hours. And we can go back over that again briefly after after our meeting is done. So really quick, I wanted to set up a quick poll. And I'm going to send a poll question out to you about the migrant education program. And so here's question number 1. How many students do you see each week that are that are identified as migrant? All right, I'll give you a few moments here to fill that out. Okay. All right. I'm going to go ahead and end. I know I didn't give you a lot of time. Sorry. I want to make sure we have plenty of time for our presenters. So I'm going to end the poll. And it looks like we have, it looks like you have quite a few people that you see that you are in a migrant status. I'm going to share these results so you can see them. And then one more question for you before I turn the time over to Maria and Armando. Okay, sorry, one more. I just saw something someone pop a question in the chat, and we'll get to that in just a moment. So my next question is your district enrolled in the migrant education program? Yes, no, or I don't know. Right. All All right, well, you're getting your answers in there. So I want you to be thinking about those students that you're seeing that could potentially be have a migrant status and the supports that you're giving them and what we might be able to do a little bit better. So I'm going to end this poll, and it looks like 68% of you said yes, 8% said no, and 24% said I don't know. So maybe today we'll be able to get some more information for you. So with that, I am going to turn the time over to Maria and Blanca and Armando.
Okay, well, thank you all. Thank you for giving us a space to talk about our migrant program. I'm excited to be here. And let me see if I can share my PowerPoint. There it is. All right, let's see here.
Good job.
Okay. So again, my name is Maria Navarrete. I'm the Migrant Out of School Youth and Health Coordinator. And a little bit about me. I was a migrant student growing up. My parents worked in the agricultural field. And so we moved around a lot when I was younger. And so now that I'm working with migrant students and their family, it's just very meaningful and a true blessing. And thank you all for being here. I'm really excited. And today we have a presentation prepared for you, and you will be learning lots about the migrant program. So let's get started. Here, okay. All right, so this is what we have in our agenda. So we're going to give you a quick overview of what the Migrant Education Program is. We're going to be talking a little bit about the Supplemental Migrant Health Services, what those are, and then how the migrant program supports migratory students. And we're also going to be talking a little bit about Migrant Education Health Fund allocation. So we're going to be talking about how schools get their funding based on the number of students that they have. And then I'm going to talk a little bit about the health reports that we use for migrant students. And then Blanca is here with me today, and she'll be sharing a little bit about what she does with her migrant nurse case manager duties. All right, so this is how our students get qualified for our program. So first and foremost, they have to be between the ages of 3 to 21 years of age. And I just wanted to throw in there that H-2A workers, so those are the workers that come from different countries like Mexico, Guatemala, or El Salvador. They're here on an H-2A visa. They too qualify for migrant services if they decide to enroll for school. And then we also qualify those that have not yet received a high school diploma, because again, our goal is to get them their high school diploma, right? And then those that move to obtain work in the agricultural or fishing industries by themselves or with their families. And then those students that cross district boundaries. So if we have students that, for instance, in the summer, they have to move to California, or they have to move to even Mattawa, right, somewhere nearby, they would qualify for our program. And then for our Native students, those individuals that go to, let's say, Cooley Dam for fishing subsidies, they would qualify for our program. And when we qualify students, we qualify them for 36 months. After 36 months, then a recruiter checks in with the families to see if they're still eligible for our program. Okay. Oh, this doesn't let me. Okay. So the migrant education program, we have what is called priority for services, and here are our top three. But one of the first one is those individuals that made a qualifying move within the last 12 months. And then those students that are most at risk of not meeting state standards, or are at risk of disengaging or dropping out of school. And then we have other proxy factors that we also keep in consideration. For instance, if they were retained in the same grade level, if they are high school deficient with credit, if they are enrolled in a special education program, identified as McKinney-Vento or have less than 90 total days enrolled in school. All right, so why are we focusing on health? Well, we're focusing on health because migrant families are one of the most underserved and poorest groups in the United States, and approximately 300 to 500 children in the United States under the age of 18 are currently working in agricultural fields. And we all know that students with poor health have a higher probability of disengaging in school or just, doing a little bit more poor, I guess, than those students that are not. And I just wanted to mention also that right now, Texas is a state with the most migratory students. However, Washington State, we are number 2. So if you're wondering why we have so many migrant students, that's because we're number 2 in the state with the most migratory students, followed by California and then Iowa. Okay. So supplemental health services and supports. These supplemental health services and supports are designed to help identify and treat unresolved health problems. That these problems do not interfere with a migrant student's ability to engage academically, and they are designed to prevent health services tied to helping children meet his or her learning needs. And some of these services include physical exams, sports physicals, corrective lenses, dental screenings, and social and emotional needs. Okay, so the migrant health program does not pay for the following. So surgeries, emergency treatments of chronic disease, braces, paid services for adults, or any other long-term services, regardless of whether these services are also considered preventative. So this is what we do not cover. Okay. And what is a supplemental health service? So it is a health activity that goes above and beyond the basic educational program services provided to migrant students, such as supplemental screenings, examinations for vision, hearing, or connecting families and students to other services or resources such as a physical therapist, occupational therapist, speech pathologist. So any of those services, that's considered a supplemental health services in our program. Okay, and this table here, this is how school districts get their funding. So for project districts are those districts that are currently receiving migrant funding, and then the non-project are obviously those that are not receiving any funding, but they can always apply to get migrant funding. And Armando can explain in detail after I'm done how they can apply. So project districts that have 100 or less eligible migrant students, they receive $1,500, and then 100 to 400 eligible migrant students, they receive $2,500, and then 400 or more eligible migrant students, they would receive $4,000. But I also want to make a note that this is what project districts receive, but if there's a greater need for these funding, they can come talk to me or Armando at OSPI and we can figure something out. But actually, districts rarely ever use up all these funding allocations. And then if there's a district, like a non-project district that has a migratory student that needs migrant health funding for, I don't know, for something, for let's say a vision for glasses or something, they can come talk to myself and then we can figure out how we can support those students as well. So just because they're in a non-project doesn't mean that migratory students cannot access those funds. They can, they would just need to come talk to me or Armando and we can figure something out. And new this year, so we have a behavioral health grant that project districts, I want to make this clear. So this is only for project districts that they can apply. The minimum is $10,000 and the maximum is $50,000. So project districts can apply to receive this behavioral health grant, and the focus really has to be behavioral health. A lot of school districts have already applied, they've been awarded, and they've implemented whatever they requested on their proposal. And it's been really neat to see also that some school districts are coming together and they're writing these proposals together, and they're hiring social workers, behavioral health therapists for their school districts. So yeah, just wanted to throw that in there and let you know of all the amazing things that the migrant program has to offer. And then with our migratory students, we use three health reports that we rely on a lot, just to make sure that our students are they're receiving their immunizations, that all of that is on file, and that those students that haven't had a physical in 3 years get their physicals done. And then my favorite one is the medical diagnosed report. So if a student has a medical diagnosis, let's say they have epilepsy, and they move to another school district, that school district is able to see that this student has a medical diagnosed alert, and they're able to follow up on the student if need be. So that is one of my favorite reports that we can run and see how we can support these students even when they move to different districts. All right, and so this is a map of Washington, and Armando actually started the Washington Migrant Nurse Project. And when he started this, it was back in 2018, 2019, and we started with 2 nurses. We started with Elvia Martinez from Brewster and Isabel Zaragoza from Skagit. And as you can see, this has slowly but surely grown, and now we have we not only have migrant nurses, but we also have behavioral health therapists, and it's just grown since 2018, 2019. So thank you, Armando, for your advocacy at the OSPI level, and hopefully this grows even more. But just wanted to share with you all the amazing work that OSPI is doing. And here we have a list of the project districts and a list of the non-project. Again, the project districts are those districts that are receiving migrant funding. We have 16 districts that are currently receiving migrant funding, and then we have 12 that are not. But we're hoping that these 12 start working on their applications so that they too can become project districts. And Armando, if you are on here, if you can talk about how non-project districts can become project districts, that would be great. Are you on here?
I am not seeing him. Let me look again in the participants.
If he's not, that's totally fine. So at our ESD, we have Nadia Bush. She is in charge of all the federal programs directors and assisting the federal directors programs with their application, so she can walk you step by step. So if anyone is interested in applying, please let me know and I can get you all connected with Nadia Bush. But that is my portion. Blanca, would you like me to share? Or not share, but would you like me to control the slides, or would you like to do it on your own?
Yes, I'll let you control the slides for me. Thank you. So hi, everybody. My name is Blanca Salgado, and I'm the Migrant Nurse Case Manager, as they mentioned already, for Eastmont School District. I've been with Eastmont for about 4 years. Previously to that, I worked at Confluence Health for another 4 years. And in this current role, I've been here for about 2 years. So my story, just to kind of start, I was a migrant student myself as well, as Maria was. My mom immigrated to the United States after my dad was killed when I was about 5 years old. My mom worked in orchards, packing sheds. She worked her butt off, worked really hard for about a year until she was able to bring us back to the United States, well, bring us to the United States with her. So she had 6 children at the time of my dad's passing, and you can see us all there in that picture around the apple trees. And that was pretty much after we came from Mexico. So I tell you guys a story not so that you guys can feel sorry for me, because obviously I've overcame a lot of barriers that we had growing up, but just to really help you understand that some of the barriers that these families have, um, like I know some of the barriers that these families have, and which makes me more passionate about the job that I'm doing. Just kind of really knowing the culture, knowing um, like their thought processes, the way they think sometimes, like, you know, for example, sometimes when I try to approach mental health with some of the parents, I approach it with like, I know that in our culture, we think that mental health or counseling is for people who are crazy. But in reality, it's not. It's for people who actually want to better themselves and stuff like that. So I approach it in that sense. And then I see a little laugh, you know, from the parents, like, oh, you totally read my mind type of thing. So just really knowing the culture makes my job a lot easier. You can go on the next slide. So migrant nursing and school nursing, I was a school nurse for 2 years, and obviously now I'm a migrant nurse. With migrant nursing, it comes after principals, counselors, nurses have provided services, and then if they find out that the student needs more services, then that's when I come in. So I assess the health needs of migrant students, collaborate with all educational and community stakeholders. For example, at the school level, I'm in constant communication with our migrant staff, with nurses, and coordinated care. The community resources are super important, especially when I'm doing my mobile clinics. I coordinate with, you know, Columbia Valley, then I try to get the insurance agencies to come in and, you know, either give free stuff to the families, be there, you know, to be able to answer any questions that the families might have in regards to insurance, or, you know, try to requalify them if their insurance has expired. So it's really good to have them there. I eliminate barriers that students and families have, especially like I mentioned, you know, I was a migrant student myself, so I know a lot of the barriers that some of our families have. So I try to anticipate what it is that they might need, and then try to, you know, be proactive ahead of time. I do a lot of home visits. I do a lot of education to our families, especially the ones that come that are new to the United States. A lot of them don't know, you know, to call 911 in case of an emergency, or that they can access, like, you know, the hospital, and that, you know, they're not going to ask them about their immigration status or anything like that. So there's a lot of education, especially with the new people. You know, they don't have a lot of resources. So just empowering them, I'm having them use the like food banks, and telling them, okay, use the food banks as much as you can and save whatever money you earn so that you can be able to pay the rent, because rent is super expensive. So just really, really empowering them. These are some of the referrals that I have for the staff members, so that they can know what types of referrals to send to me, like if the student needs a vision or hearing or dental appointment or a physical appointment, if they have chronic absences related to health for more than 5 days, they can refer those. So it's just a little cheat sheet that I've created for our migrant staff, so they know what type of referrals to send over to me. You can go on to the next one. So I've had the privilege of, you know, getting to know a lot of families, and, you know, get to know their backgrounds a lot. With one of them, one student in particular that I'm thinking about is this student was referred to me by the migrant staff. The student wasn't attending school. We thought maybe it was related to health, because mom was saying, you know, it was related to illness. So I ended up setting up a meeting with the parent. I built and the student, we built a relationship. It was me, the student, the parent, and the school psychologist. And then just kind of, it was a really long meeting. It was probably a good 2-3 hour meeting, just really talking, figuring out what was going on, what obstacles the student had, and how we can overcome those. And like a week later, I received an email from the student letting me know, hey, I'm feeling really lost in life. I don't know, what I'm doing with my life. Right away, I, contacted the school psychologist. We went and did a home visit. And thankfully, the student was not suicidal, but I was concerned because previously she had like a suicidal attempt. And we got her into counseling. I'm able to meet with her on a weekly basis. She wants to be a nurse. So I'm able to really mentor her in what classes she can be taking at school and everything. And, I see her a lot more happy now. Her grades are increasing, her attendance is increasing. So that to me was like one of the moments where I'm like, oh my goodness, thank goodness I was there. If a migrant nurse wouldn't have been there, like I would be hopeful that she reached out to somebody else. But I just felt privileged to be able to assist her and help her out. Another student who was hospitalized for several months at Children's Hospital. I also assisted them, just trying to figure out once the student came home, if the student was going to need educational services at home, or if the student was going to need to come to school and need further like health assistance. So this happened last year where I was assisting this family, and then recently the dad suddenly passed away. So we had the migrant staff like pitch in and help because the mom was at the hospital and she was not feeling like going grocery shopping or anything. She was just not doing well. So I ended up doing the grocery shopping, going to the parents' house, taking it to them, and then talking to the mom. She was confused about the medication that was given to her that day. I was able to look at the medication, and thankfully I did, because I realized that she didn't know what the medication was given to her for. It was she thought it was sleeping medication, and it was really pain medication. So a lot of the time it's like you're not only treating, the student, you're also helping the parent, because, as we all know, if the student's not doing well, the parent's not doing well. If the parent's not doing well, the student's not doing well. So you have to really take care of the whole picture. With the same family too, I kept calling the parent and asking, if we can get a form filled out so the student could get a vision exam, and I wasn't getting it back. It was since before the dad passed away, so I was in communication with him, and I wasn't getting anything back from them. So then I finally was able to stay after school one day and till the parent was able to get off work so she can fill out the form and the student can get the vision exam. And, I just figured I'd rather stay an hour later and not have the parent miss work, because, obviously she's a single provider right now. So she's needing, that extra income right now. And then this other story with the Venezuelans, they were in the newspaper. So some of you guys might know them already. This winter, able to get donations. I was able to go around town, find the cheapest heaters, and was able to take him to them. But with this family is one of the families that I think our district has had done a lot of home visits, including myself. And for me, it's, when I visited, it's related to health, clothing, helping them even translate, to help them get a garbage can, doing mobile clinics specifically so I can try to get them to go and get all their physicals, get all their immunizations going, that kind of thing. You can go to the next one. So this is a migrant health referral form that I've created. It's really just for our migrant staff, nurses, and counselors to be able to fill out this form and send it to me anytime they have said, you know what, like for example, for immunizations for the nurses, like I've attempted, several times with this family, I haven't been able to get them to take their child to get immunized. Can you assist me? So that's when I come in and I try to figure out what's going on, what barriers or obstacles is this family having, that's preventing them from getting the child immunized. And I've had this year about 121 referrals, including a whole bunch of follow-ups. And this health assessment tool here that I've also created, it's basically each migrant staff member at each building calls family or the student and asks them the questions below. So they ask them, when was your last physical? Do you have insurance? Do you have any dental, when was your last dental appointment? Do you have any vision or hearing concerns? So they're asking all these questions. Then what they do is they send me a referral and let me know, hey, Blanca, this family hasn't, this student hasn't had a physical in the last like 3 years. Can you help them? So that just kind of helps me be able to filter down and really focus on the need, because there's a lot of need out there. We have about 675 migrant students so far in the program. I've called about 173 for physicals, vision about 51. I'm also meeting with the 8th graders with that behavioral health grant that Maria was talking about. So I'm meeting with them, checking in with them to see how school's going, to see if they have any health concerns, any mental health concerns, and just checking in to see what their goals are for the future, letting them know that I'm here for them if they need any assistance. And a big part of my job compared to when I was a school nurse, I do a lot more follow-up. So, I might have 173 physical calls that I make, but out of those, I'm still following up. Like, have you scheduled an appointment? Have you actually gone to the appointment? Have you gotten insurance? Like, just a lot of follow-up is, a lot of what I do. And this is a migrant staff standard script that I've created just for those staff members that are calling home. And so they can really know what to ask the parents or the students. You can go to the next slide. And this is just another paper health assessment tool that I created. This I use whenever I do my home visits, so that I can be able to ask the parent all the important questions that so a lot of what I do too is the documentation. So with the migrant program, I have to document the students' physicals, if they're up to date on their immunizations, their dental, if they gone to the dental appointment. So all these things right here are stuff that are requested from the migrant program. So I just needed to have somewhere so that I can make sure I scratch up all the check marks there, get it all done. And you can go to the next one. This is a migrant health brochure that I've created as well. This brochure that I created was just kind of the way I call it, just my brain dump. All the questions I've had from staff members, from our parents, on resources like, hey, do you know of any childcare for my child? Or do you know about legal, like lawyers and stuff like that? So I try to put everything that I've had my migrant families ask me, so that I can have everything in one place and be able to just really hand it to them. And I also created a first aid information sheet in Spanish and English. I wasn't able to find one in Spanish. I found 2 good ones in English, but they didn't have everything that I wanted in there that I thought our families needed. And so I ended up combining 2 English ones and then translated it in Spanish. And you guys are welcome to use any of these resources that I have on there when Lania shares the PowerPoint. You guys can make it your own. I don't mind. Copyright is okay with me. Let's just get this information out to the families.
Thank you, Blanca. There were some questions in the chat about your resources that you're using. Melanie Wallace asked if she could have or if we could have a copy of the migrant health needs assessment and the worksheet, a blank copy of the referral form, because she would love to create something similar in her district. And there was a question from Michelle Rogie about accessing that, an application for the behavioral health grant. So
Yeah,
That would
mailing,
be
yes, totally. You guys can use it, like I mentioned, like even the brochure. I don't mind if you guys, put your logo on there and just call it your own if you're happy with it. Like, it's fine. I just want our families to have all those resources.
that's fantastic. Thank you. We'll make sure we get those that information in the Google Drive for the nurses to be able to access. Thank you so much for sharing that. And we have Armando. Sorry, I don't know if I'm gonna say your last name right. Is it Isaias Garcia?
Yeah, close enough.
Okay.
Besides,
Oh, I'm
no worries.
sorry, but
It's
thank you so
okay.
much. We're glad you could join us um and be part of the presentation there. Maria, were you controlling the slides? Did you want to pull those up for Armando?
I was. He doesn't really need a slide, Armando. Remember how I asked you if you could just talk about how non-project districts can apply to become project districts? If you can just touch base on that, please.
Yeah, of course. And I apologize for being late. I'm getting pulled in so many different directions this week as travel's picking up. So regarding what we call project or non-project, essentially is those districts that are migrant funded and those that are not migrant funded. Just about almost every single school district with, I would say, a minimum of 10 or so migrant eligible students are eligible to apply for Migrant Education Program Title I Part C. Of course, with anything that comes with funding, that there's some responsibility. But just about every single school district, I would say, once a year or multiple times a year, around this time or close to maybe around April or May, your federal programs director or somebody in your school district is going to get an email from my director, Sylvia Reina, letting you know, hey, you have X amount of dollars eligible to you to implement such a program. If you become migrant funded, then there's some requirements around establishing a parent advisory council. And then with that comes the support from the North Central ESD. However, even if you don't apply for the migrant education program, we still are able to support you in some capacity. Every single student that is eligible for the program is entitled to supports and services, whether it's directly from us at the state or through our partners through the ESD, or sometimes through other third-party contractual partners that we have across the state. But essentially, relatively small grant application through EGMS, and then, or you can just reach out to us directly at OSPI, and we can get you on track in getting that done. The funding is contingent really upon the number of eligible migrant students. However, if that amount is relatively small, we do make exceptions and try and give you a more sizable grant application or grant allocation, I should say, to implement a program. And then depending on the need, we're always willing to work with every single school district depending on what their needs are, the severity of the needs, or where they intend to focus on. In this case, if your needs are specific to the health of your students, then we can work with you on how to provide some support. So I myself have been making it a point to really support smaller to medium-sized school districts to receive supplemental nursing and behavioral health supports. And that's mostly because these members as a part of our team tend to be expensive and districts cannot necessarily afford them. So we find other ways to work collaboratively to be able to do that. And that's essentially what we intend to do, hopefully this year, perhaps the next year with the support of Kathy. Can we possibly bring another nurse case manager at the regional level to support some of your school districts to benefit from these additional supports and services that Blanca provides, so that you yourself as a school district don't need to hire a school nurse or a nurse case manager per se, but we do this in a collaborative fashion. So Blanca is an excellent example of the work that we do. Her and I work quite closely. She's very independent, understands the program quite well. And she's made a huge, huge change in Eastmont. But she is one among, I would say at this point, perhaps 15 or 16 of her colleagues statewide. When Kathy and I first spoke about the possibility, I think we talked about maybe just bringing 2 to the state at that time, I think right before COVID. And now we've expanded about to 16. And the impact has really been substantial. So if this is something you're interested in and looking for additional support, I welcome any contact between myself or Maria. Maria is my colleague in the North Central region. So highly recommend you can get connected and acquainted with her. She can give you kind of a rundown of the program, what supports are available, and where to get you essentially started if you wish to be migrant funded or if there's a specific need in your region where we can be of service. If you or your district is not ready to accept Title I Part C funds, then you can let us know. But essentially, it really just starts with that.
Fantastic. So we do have a comment in the chat from Melanie. We don't have a migrant nurse currently, but the job is posted in her school district. Our family advocates at the school buildings currently work with us. I'm sorry, currently work with us nurses to do these things. Melanie, could you clarify a little bit what things are you referring to, like the home visits, or could you elaborate a little for us? And okay, well, maybe she stepped away from her desk, so we'll try to catch her again next time. Oh, sorry, she just posted again. Some of the things that they do, but not usually home visits. Gotcha. Okay. All right. So it looks like we have some time to ask more questions, or anyone have any questions for Armando or Maria or Blanca?
Well, I'm just going to share a comment to thank, first of all, Armando, I want to thank you for coming on and presenting today, as well as Maria and Blanca for providing some guidance on this program. We do, to me, have a gap in our services that we're able to provide in our region that we're still hoping to meet through some additional school nurse case management work. And for those of you who are involved in the Washington State School Nurse Case Management Program, this might sound somewhat familiar. I don't know if Nicole is on the line or not, but we've had people serving in school nurse case management positions. Michelle Rogie is on the line. They've been serving in the previous model project that we had running on school nurse case management for Washington State. And so Armando nicely has been able to take that program and mold it into a migrant health school nurse case management program, which has really been perfect because now we have this additional opportunity once the Washington State program for school nurse case management, kind of the project concluded. So essentially that was a project that was intended to be able to provide some data that showed the value of school nurse case management work in the school setting. And so it concluded. We continue to work towards integrating school nurse case management work into all school nurse roles. So it isn't that a school nurse case manager needs to be a separate entity from the school nurse. It's really part of the school nurse role to case manage students as they have time available to do that. And with this additional support of a migrant health school nurse case manager, then you have another support system within your school to really target those students who are in such great need. So thank you so much for being here and talking about this.
Yeah, thank you all again for giving us a space to talk about the migrant program. And thank you all for the amazing work that you do for students in our school districts. Thank you.
There is a question in the chat from Michelle. Is there help through this program for asylum families?
The answer would be yes and no. It's really contingent if they are migrant eligible according to the Title I Part C definition. I think one thing to remember is, not to confuse the word migrant with immigrant at the same time. They're two distinct definitions according to Title I programs. So they may be eligible, but at the same time, they may not. It just really depends if they are engaging in temporary seasonal agricultural work, and also if they're moving, hence the term migrant, across district boundaries, and therefore interrupting their academic engagement. So if they are eligible for Title I Part C and they're also asylees, yes, we can help them. If they do not qualify under the criteria, then chances are that's probably going to be a basic ed support.
And I wanted to add something that Kathy kind of brought up. A good example, I guess, for like, seeing migrant nursing, migrant case manager, or just a case manager in general versus like school nursing. The way I see it too is just like at the hospital. At the hospital, you have your acute care nurse, and then that's actually, seeing the patients, giving them medications, doing interventions for the patients. And then you actually have your case manager who's trying to eliminate any barriers that the patient might have to discharge. So that's, the beauty about having a case manager in a school district, because you're able to really, help eliminate those barriers and, connect the families to the community resources that are needed.
The one thing I would add about our program is that we're probably one of the more flexible ones, although the definition is quite stringent. But once you become eligible, then there's a lot more we can do than compared to other title programs. So for example, some of our other nurse case managers of the migrant ed program have their own budget to spend on specific items, or even in some cases direct services to those students and families, where we often find that most school nurses or in some cases just as a part of the school nurse code, there isn't a supplemental budget really to be able to spend and cover some of the supplemental costs. So like Blanca mentioned, supplemental nutrition, clothing in some cases, school supplies, transportation, all these things are afforded to every one of the positions that are funded through the migrant ed program. And I would highly encourage you, if you do have an existing migrant ed program and you wish to maybe bring a similar position, I am happy to discuss this with you, and we can make this happen. Usually we just look for how can we make it feasible, the costs are reasonable, and they're allocable to the program. And generally, that means just sharing a position with a number of school districts. And we found that this model tends to work quite well. And we've approached it this way just because the mobility of families are within district boundaries and they're relatively close. So it just makes sense. Why not just bring a pool of school districts together to be served by one individual who has the capacity, and then flexibly move across those boundaries and be able to serve them. So should they move from one district to the other, Blanca, for example, could potentially work with some of those students if she had one of those districts under her consortium. Blanca only works with one school district, but many other of our nurse case managers have multiple districts. And the numbers are fairly reasonable. They're not in the thousands by any means, maybe a couple of hundred, but that doesn't mean every single student has a particular need. So we're always working supplementally, and the burden isn't too heavy, but sometimes it gets kind of tough. But just reach out to us, let us know how we can support you, and hopefully we can bring more of these positions to your region, which may include some of your districts in some capacity.
So that brought up a question in my mind for Blanca. When students that are identified as being in the migrant education program and have that status, and you've worked with them, if they've moved out of your district, have you worked with the incoming district to prepare them? Or because I know that that's not your school district, so you have a limited capacity to help out, but have you helped with transition at all? Has that ever come up for you at all?
That actually hasn't came up for me. Yeah, I haven't had that happen to me yet. Or at least when they've moved, maybe the ones that have moved have not had health services from me. So I haven't, yeah.
I can help answer that. That happens to me all the time. So I'm not a nurse myself, but I get calls all the time from students moving from district to district. And then I'll give you one example. We had one student go to California, and I had a family reach out to me. We have the migrant student information system where we are able to put sort of a flag in their student information that lets them know that there is a quote unquote health concern that they should be on top of. And we also include the contact information of the sending district to the receiving school district. In that case, they contacted me It was the initial referral was from one of our nurses in Skagit. And then they asked me what was this particular need. So we connected between the three of us, and then we let them know, hey, you know, the student I think was diabetic or something. So we didn't fully disclose much information in the migrant student information system, but rather we let them know that there is some kind of health concern that you should be on top of and whom you should be connecting with on a needs basis. I think we had provided some support through CMAR, so they wanted a little bit more information on that. We gave them clarification, but it's not always the case. I will say that Washington State is the only migrant ed program in the nation that does this. We're the only ones that provide this type of flags and supports for health. To my knowledge, no other state does that. So we provide that as a courtesy, but we always make the connections where necessary. But usually we have that information, and just very minimally, just so that at least they have some kind of like heads up that something is pertinent with the student.
Any other questions for Maria or Blanca or Armando? One thing I can say is that the migrant education program has provided some funds to the ESD, and that is how we got our spot vision screeners that sometimes you check out when you're doing your vision screenings. And one of the things that we ask when you check those out is that you do provide some information about students that have had vision screenings and how many of those students were migrant or in the migrant program. Armando, would you be able to speak to why you're collecting that information when we do those vision screenings?
Yeah, great question. So one of the requirements from us, from Washington, D.C.'s Office of Migrant Ed, is that we let them know which students were served under their definition of a health service. So if they received supplemental vision screening and support, then we want to be able to notify that and submit it to the national database. So when you let us know which students were served, whom were also migrant eligible, then we can note that in our migrant student information system and then be able to interface with the national database. That is our way of letting essentially the Department of Ed in DC know how many students we're serving statewide and in what capacity. This is one of the efforts why we wanted to really start a workforce for nurses through migrant ed. And when I began in 2017, I think about 300 students were served out of 32,000, which was frankly pitiful, given the nature of the need of our students and population. So we've since now increased that closer to 5,000. And we're still climbing as we progress and go and move forward, just changing the paradigm around what is the service, how we allocate funds, and then how we think innovatively to provide those supplemental supports and services and not supplanting what currently exists. And the vision screening project was really one of those things that we really wanted to take on. I think at that time, some of the WACs around vision requirements had changed, but there was no additional funding. So Kathy and I kind of brainstormed a little bit, and we thought it would certainly help a lot to not only help those districts that were migrant funded with some of these spot devices, but also those that were non-migrant funded at the same time if we work collaboratively so that they themselves could use those and then become sort of aware of what the migrant ed program was and then have our students served at the same time. So it was kind of a dual effort to screen students across the state with a tool that made the job a lot easier. And at the same time, we're being able to serve and generate those numbers so that we can demonstrate that our funds are being used as intended in Washington State.
Thank you.
And
Go
just
ahead,
a reminder regarding those vision screeners for those of you who are involved in summer programs, you know, like summer, if you're out at migrant camps, for example, or you're doing health programs, those spot screeners are available all year long. So if you have a need for those, we have them available for those programs.
All right. Do we have any other questions? So I wanted to put the poll back up for everyone. If you are if you are enrolled, if your district is enrolled in the migrant education program. We only had about 26 people able to participate in that. So I'm going to relaunch it now after you've seen the presentation and see if you want to answer. See. Okay. All right. So poll is back up. And we will make sure that we have Blanca's handouts or the forms that she had. I'll make sure that we get those in the Google Drive for you, as well as the slides, so that way you can look at those again that Maria had that she used during her presentation. All right. Okay. So we've got 21 who answered so far. Okay. Anyone else wanting to join in the poll here really quick? Okay.
Lena, on my side, I see 45 have answered.
Okay.
Okay.
Sounds fantastic. Okay. All right, I'm going to go ahead and close the poll and then share out the results. So, it looks like we've got 70% that are in a migrant or a district that's in the migrant program, and 15 that aren't, and 15 that don't know. So, if I hope you found that the information today is something that you can use for your students and take back to your districts and help them understand a little bit more about some supports that we can provide for students that are in the migrant status. Okay. If there is anything else for anybody, I will just go ahead and it looks like we have Dr. Wallace is on with us now. So without further ado, we'll turn on time over to Dr. Wallace. Thanks for joining us.
Great. Good morning, everybody. Hope you're all doing well. I don't have a PowerPoint this morning, but thought I'd just give updates on respiratory illness in general, talk about the DOH guidance, and answer questions that might be coming up as people are reading through updates or alignment with what the CDC released 2 weeks ago. And then talk to you all about pertussis as well, because I know a couple of you are experiencing it directly, and plenty of people are hearing that pertussis is out and about and circulating in the community. So I want to make sure your questions are answered there. In general, the respiratory illness season is slowly winding down in North Central Washington, although we've seen a little bit of an increase in emergency room visits due to influenza over the past week. That's on top of pretty consistent downward trend for influenza, RSV, and COVID over the past 6 weeks. We had a little bit of a bump in the end of January, and since then have been downtrending. Outbreaks in long-term care facilities are on the downtrend as well. We had some with RSV, some with influenza and COVID, and overall, the numbers of long-term care facilities among us are decreasing. We see wastewater data for COVID in Chelan, Okanagan, and Douglas counties decreasing. And healthcare still reporting some access challenges, staffing challenges because of respiratory illnesses. We still have more hospital beds and ICU beds occupied by folks with influenza, particularly compared to previous years. But again, still on the downtrend. So overall respiratory illness is in decline, but we're still not quite yet out of our respiratory illness season. I hope folks have been able to digest and review DOH guidance that aligns now with the CDC guidance for isolation duration for respiratory illnesses and kind of tucking COVID into just a general recommendation for all respiratory illnesses. I think it simplifies things, but I want to hear how you guys anticipate responding to it and operationalizing it in the school setting. That recommendation for just respiratory illnesses in general to isolate for 24 hours until a fever goes away for 24 hours or and symptoms are improving is pretty consistent, good advice across the boards for any respiratory illness. There are recommendations strewn throughout, and I think a special section on things that you can do to prevent transmission, like masking, continuing to mask given the reality of, a contagious period hasn't been decreased any at all. And so folks can still be contagious with any respiratory illness, influenza, COVID, RSV for 5 to maybe even up to 10 days after onset of symptoms. So recommendation to wear masks, recommendation to improve airflow and filtration when possible, frequent hand washing, respiratory etiquette, physical distancing. I know that's one thing that healthcare is really looking at trying to make possible, that ability for staff members when they're taking breaks or not directly involved in patient care can distance if they've recently been sick. And then testing, appropriate response to testing. There are some illnesses, as we'll discuss in a minute, that do still require longer durations of isolation because of their severity. And so, a negative COVID test can be reassuring, but there are other illnesses that might warrant antibiotic treatment or longer durations of isolation, and that public health should be notified. We're working with our healthcare partners around notifiable conditions and those ones that we really want to jump on top of and help with contact tracing and supporting individuals impacted and affected. And then there's a section in there on, interactions with high-risk individuals and recommending that you don't be in contact with individuals that are high risk of severe respiratory illness, severe impacts of COVID or whatever that illness might be for 10 days until you're testing negative. So I'd love to hear questions. I think, Ben, did I see your hand raised? There might be some others. Let me switch and see if I can see the chat too. Yeah, go ahead. Maybe not.
It looks like Ben had to step away from his desk for a moment, so we can catch
Okay.
him when he gets
All
back.
right. We'll catch him back up. Anybody else with questions about respiratory illnesses in general or those DOH recommendations?
Dr. Wallace, yesterday we did get kind of this summary of the revisions, and it went
Okay.
out as kind of like a talking points document. And so
Yes.
they have, like we thought yesterday, they were going to revise it, and they did. So they've resent it again this morning with some revisions on it. So.
Okay.
So I'll resend that to you, and we can now share that out, and so that's
Okay.
going to be coming to everybody.
Great. Any surprises in there, Kathy? Sorry, I haven't seen it this morning.
No, and I just got it, so I haven't really had a chance to read it. It looks like they did do some revisions to it yesterday, and I think they were trying to make things maybe a little bit clearer. What we're hoping is that they actually put together more of a tool, so it's not just so much like writing, and we actually have just these quick tools that we could share with parents and with other staff, because, they really need more of a flow chart would be much more helpful and easier for people to read than all of this. L&I, we're still working with the L&I guidelines as well. So L&I, has going to have their own documentation that we need to follow for district staff. I think one of the questions that comes up frequently is just a reminder of how people should be managing in their own health rooms, because these guidelines are really for the school in general, and the school health rooms have continued to follow the healthcare guidelines. For the last 2 or 3 years, we really have fallen under those guidelines instead.
Interesting. So yeah, there's been a pretty consistent difference in healthcare duration of isolation, and that's that continues. So healthcare entities observe a 7-day isolation, or 7 days before you return to work, and return to work with a negative test. So are people using that in health rooms, or is it more the ventilation, spacing, masking, those recommendations that are being employed in health rooms?
Well, what do you think, Amber? I see you on the line, Amber Verman. I'll call on you. What are you guys using in your district? Oop, you're muted.
Currently now with the pertussis, we're using just the paper the masks, paper masks. Well, and it's strongly suggested, so you can imagine how that's going.
Yeah.
So, but anybody with symptoms is being asked to go home. So, yeah. Sorry, I've kind of been working on. I just got some updates, so that's what I was been working on.
Looks like Ben's back. Ben, did you have a question before you stepped out?
Yeah, sorry about that. I had a kid come in with a bloody mouth, but my question was, it just from the start of your stuff about the cold symptoms, respiratory symptoms, and sending them home and those types of things. And I'm just wondering if there's still that list that goes with that is pretty much any symptom they have to be going home. Because what I find here is that the practicality of there's so many kids here right now with a cold and no fever. That probably a huge percentage of people I would be sending home, which would just be an all-day process of trying to get people out of work and getting their kids from remote locations to send them home. So I'm just wondering if we're leaning more heavily on do they have a fever or not, or if we're still like recommending a situation where if they have a runny nose or a sore throat, that we try to get them home, and then that's kind of on us to try to make a decision that maybe or maybe not we're qualified for, as far as determining whether they go home and stay home until they have a doctor's note, which is even further challenging.
Yeah, and I've heard recently about some of those challenges in obtaining doctor's notes in alignment with clinics. But no, I think, if somebody comes with new symptoms, it's hard to know exactly what that is and whether it's a severe illness or not. And so kids with new respiratory illnesses ought to go home and then come back when symptoms are improving. And if there has been a fever, that fever is gone away for at least 24 hours.
And so just a little bit further on that, sorry, Amber. So I'm just coming from a school nursing perspective here to determine new symptoms for a first grader. It's hard to even figure out what their symptoms are. You're just kind of working on like a mystery. Yeah. And to figure out when their symptoms started, and then to actually implement that, I understand where you're coming from on that, but I just think that you should know that the reality is that, and I have a small school building where I know everybody's name, but when you're talking about a large quantity, the monumental task of trying to keep track if it's new and sending them home and then trying to track them on the way back in and doing all that is not, I don't know I'm not super confident even on my small quantity that I can be super accurate on that.
Yeah. Thank you. Just try and be as accurate as you can. Sometimes it might need to be a conversation with parents. I know first graders are, really tough to get clear history from. You do what you can with them and involve parents if possible.
We're kind of in the thick of it because we're having, pertussis cases here.
Yeah.
And we are basically, I think it was a good reminder for me, to think about, the majority of our students are vaccinated. And so students who are vaccinated may be showing, those symptoms are going to be, muted potentially. And so they can still be positive with pertussis and just have, cold symptoms and maybe a mild cough. They're not necessarily going to be having that, whooping cough, but they can still be passing it on. And I think that was a good reminder because again, the majority of our students are positive, and the majority of our positives are fully vaccinated. And we've had a lot of the parents from our positives, well, not a lot, but there's definitely been that handful that have been not happy that we've said, hey, they need to go and you might want to consider having them tested. And they're just pretty adamant that that's not what it is. And then lo and behold, guess what?
Test positive.
That is what it is. So, it's just something to keep in mind. And we also do take into account that their alternative diagnosis that, okay, they're better after 24 hours. But we're pretty much, if anybody's got symptoms, we're sending them. And I'm using a spreadsheet to track. And I'm using it by building. So the office staff is helping me maintain that. And then I also have a spreadsheet that I'm shared with Margot at Department of Health, and she and I work on that together.
Yeah. Thanks for that, Amber. I know Kristen Hosey and Stephanie Statilli, maybe Margot also are here as well. So they've been working. Well, if you guys haven't met haven't met Kristen, she's the new interim director of the health district. And then Stephanie has been directing our immunization services, but prior to that was our communicable disease nurse, has tons of history and experience with communicable diseases, the notifiable conditions that we actively trace. So appreciate you guys being here. Amber mentioned pertussis, and so want to share that. We've been tracking pertussis since the beginning of February. That's when the first case was reported to us, February 2nd, I believe it was, through contact trace. And well, let me say first that a school nurse reported the case, which we really appreciate because the healthcare provider had not yet reported it. And as soon as we get the report of a notifiable condition, we can start case investigation, contact tracing, and try and identify where transmission is occurring and try to reverse that. So we conducted an investigation in one school. The first school had also a high absenteeism rate at the time. I think they had reported a 13% absenteeism rate. So a lot of respiratory illness going around, and with the knowledge that a student had tested positive for pertussis, through the investigation realized that student could have been positive for a month prior to identification of the diagnosis. Recognized that pertussis was probably spreading broadly in that one school. So we communicated with that school, communicated with healthcare partners to make sure they could get access to testing and treatment when necessary. And so CVCH and Confluence have been a huge help in trying to maintain access for people that need it. Since then, we've identified cases in 2 additional schools. So we're working with 3 schools now, and then cases coming up in the broader community. We've not been able to identify links between schools or links between individuals in the community, and even identifying links between some students in some schools is really difficult to do, which leads us to believe that pertussis is actively spreading, and there's more of it out there than we've been able to detect. It's not identified yet as, you know, a part of one specific activity, one specific sport, one specific gathering place or community group. But that as we continue to do testing, or our healthcare partners continue to do testing, they're uncovering a lot of pertussis out there. We have concern about pertussis because it's a severe illness, especially for infants. So 50% of babies or infants less than 1 year of age are hospitalized, can cause pneumonia, can cause apneic spells, need for a ventilator in severe cases. And so folks who are pregnant and folks who are less than 1 year of age are high risk because they've not built the immunity yet to protect them. As kids grow up, they get more immunizations and they're better protected. And as Amber was saying, those individuals that have been vaccinated are more likely to really have just pertussis presenting as a mild respiratory illness. Pertussis does have the characteristic whooping cough and progresses through 3 phases of illness. So for a week or two, the initial signs and symptoms of pertussis are no different than most other respiratory illnesses. That's a catarrhal phase where you have upper respiratory congestion, cough, runny nose. But then you enter into this paroxysmal phase where you get the classic whooping cough that's coughing uncontrollably, can't catch your breath between coughing. You try to breathe in and do that whooping sound, and might also have vomiting after coughing, and the coughing might be worse at night. And it typically takes a long time for that coughing to clear, can be up to 2 months because of the damage that the toxin that's released from the bacteria does to the airways. So it's something we certainly want our little babies to not encounter, but because of that two month duration of hacking cough, trying to minimize spread. And spread by droplet precautions. So masking does work really well to minimize the transmission. There's not asymptomatic transmission like there is for COVID. And so individuals who are not symptomatic are not contagious, but when people develop symptoms, they are contagious. The treatment's pretty simple. So azithromycin, a Z-Pak, 5 days of antibiotics will reduce the severity, decrease the risk of transmission, and decrease the duration of illness for people that take it early in the disease course. It can also prevent illness. So we recommend that people who are in those high-risk groups or people that are they themselves in contact with people that are high-risk group get preventive treatment if they know that they've been exposed. And communicating to everyone it is a notifiable condition. So please, if you suspect a case, report it to Chelan Douglas Health District or your LHJ. And then another reason to stay up to date on immunizations, because immunity does wane over time. And so it's recommended that, kids get the DTaP in childhood vaccines and then a Tdap at 11 to 12 years old. And then all adults once in their lifetime should get a Tdap, so the tetanus with pertussis. And then anyone in pregnancy should get a Tdap booster with each pregnancy to pass that immunity on to baby. So I'll stop there. How are you guys experiencing pertussis, or what questions do you have about pertussis? Look through the chat, hand, foot, and mouth again in Bridgeport.
Has there been a lot of activity up in Okanagan County or in Grant County? Have we seen much happening in those areas?
Yeah, great question. I am not aware of Grant County cases. We've had 2 cases of pertussis over the past 3 months in Okanagan County. One individual had traveled with sports to Chelan County, but was not in contact with anyone from any of the schools that we've been working with. So don't have an epi link, and it may or may not have come from travel to Chelan County.
Taylor has a question in the chat.
Great. Let's see. Reasoning behind not treating unvaccinated. Yeah, Taylor, great question. So I've talked with DOH at length and several times, several individuals with a lot of experience in this. And I'd say the one way we treat unvaccinated individuals differently is by begging and pleading to get vaccinated. But we're not excluding people from school if they're unvaccinated, because this can, the pertussis can be contracted or transmitted by fully vaccinated individuals. And so it would be unfair to exclude those individuals that are unvaccinated. The people that are unvaccinated do have greater risk of severe illness. And for that reason, you could say, why don't we recommend keeping them safe by keeping them home? But the exclusion of kids from school is something that, we don't do lightly. And it's important for kids to be in school. And so, this change in DOH isolation guidance and so many recommendations that have been lessened from more conservative recommendations are really recognizing that you got to balance the disease severity with the need to keep kids in school and people at work and families doing what they normally need to do.
Dr. Wallace, there's another question in the chat from Erica. The first one was about excluding students that have exemptions, but I think you kind of just spoke to that.
Yeah.
Her next question was, can you define an outbreak and at what point would shut down a classroom? She has 2 cases in one class.
Great. Yeah. So an outbreak is defined for pertussis. It's different for every illness, but for pertussis, it's 2 cases that have that exist within the same area. Shutting down a classroom, shutting down a cohort, shutting down a school is, again, something that is pretty serious. And, we learn from COVID to avoid that as much as possible. And so if kids can continue to learn, take precautions, like, I made a strong recommendation for those schools that are experiencing outbreaks to adopt masking. The situation of one classroom having more cases than any others is definitely a situation where that one classroom should adopt more precautions to prevent transmission.
And it looks like Stephanie and Kristen chimed in on that as well. Do you want to say anything more, Stephanie or Kristen?
Not really. We just I think Dr. Wallace has covered most of it. We're just keeping on investigating all of our cases that we're getting, and I think it's really shown that it's really important that the role that you all play as school nurses in notifying us, because sometimes we're getting that before we're getting the notifications through the providers. Like in the case of the first one that we were notified about. So, and Amber said, I think the number of confirmed is higher, and it's might be. I think I got a call this morning for another case that we're looking into. We're just trucking along and calling up the the family, the individuals, and letting them know like next steps and recommendations for antibiotics, etc., and getting in to see a provider. So that's our role. Stephanie, I don't know if you want to add any.
Well, no, I mean, if we're getting lab confirmed cases, we're working those up individually as we would any pertussis case. And then Margot's been working on the probables and the suspects. So that's kind of our how we've been sorting through them all to kind of keep some semblance of sanity around here.
Yeah, these guys are doing great detective work and really working hard, especially with those, like Stephanie was saying, people that have tested positive, or people that have known contact with somebody with pertussis and are having the classic symptoms. Those are the people we go to first to interview, to investigate where they might have contracted it and who they might have been in contact with. There's a broad number of people with the classic symptoms that don't have any contact, and we interview those folks as well to try and find out where they might have been in contact, if indeed they do have pertussis. One of the trickier things is that not everybody tests positive, so depending on the stage in which you get tested and how well they do a good job of swabbing way back in the nasopharynx, the collection might be inadequate. So you test negative even if you do have pertussis, but we consider a probable case anybody that's had known exposure and then develops those classic symptoms. Those folks are getting treatment, and if kids are asking about return to school, or unclear on it, I'm working with healthcare providers to try and ensure there's alignment here. But people with probable or lab confirmed pertussis should be out of school for 5 days while they're on their antibiotics.
I don't know if everybody knows Garth Donald. I see him on here. He is not doing pertussis. But he is our new mental health and substance use coordinator, and I don't know if he has updates. And then I know Kathy has been working with a student that we've been coordinating with regarding vision, the vision manual for you guys. So there's some other things in addition to respiratory illness, but just plug those in too. We're happy to answer about that. I don't want to shift off of pertussis, but if other folks have questions, but just looking at the time. I know Kathy told me that I would be eating into her time if we went past 10:30, so.
That's okay. I like you to owe me, Kristen.
We did have another question just pop up in the chat from Taylor. We have had families had trouble getting antibiotics. Do you know if pharmacies will be getting larger shipments if our area is in an outbreak?
Why don't we reach out to pharmacies? Kristen, maybe talk with, I don't know if Kayla's the right person to do it, or call regional pharmacies, or Taylor, if you want to share with us what pharmacies those are. But I'd not heard of any azithromycin shortage. It's usually regularly available. So if people aren't able to get it.
We had a family, the mom went to 4 different pharmacies looking for the antibiotic. And they were this is in Wenatchee, so they were pretty common. Like, I think she went to the clinic pharmacy at Confluence. They didn't have it. She went to Walmart and then I think somewhere else. And then Safeway ended up ordering it for her, but it was still like a 2 to 3 day delay in the kid getting the antibiotics. So obviously that's more time out of school.
Right.
The mom was also undergoing cancer treatment. So it was just this whole, situation where it's like, how do we not have these antibiotics readily available?
Yeah. Yeah, thanks for alerting us to that because this is the first we've heard of it. Kristen, would you mind having somebody call East Wenatchee pharmacies and see if there's still a shortage or if there's anything we need to do that we could ask DOH if they have a stockpile or a way of increasing supply real quick.
Sure, I'll reach out. No problem.
Okay. Thanks. Thanks, Taylor.
Thank you so much.
All right.
Does anyone else have any other questions for Dr. Wallace or Stephanie and Kristen or even Garth, since he's on there patiently waiting too? All right, well, if you do, you think of something, please feel free to reach out, and I'm sure they'd be happy to hear from you, or we can also pass on any questions for you as well. We're so grateful for your time with us. Thank you for being with us. We really appreciate what you're doing and the help that you're providing us.
Thank you. And thanks for all that you guys are doing to keep kids safe. Much appreciated. You guys take care. Have a good day.
Thanks, you too.
Bye.
All right, we're gonna turn the time over to Kathy for our school nurse update.
Okay, so we've been sitting or standing for like an hour and a half. So please do stand up for a minute. Or stay standing if you want, while we go through some updates. So we're going to have some state updates, some legal, what's happening with the legislature, just some things for you to be aware of. So we'll go through these updates over the next 30 minutes, but I don't want you to just be sitting and not moving at all, because you're going to get all stiff and sore. Okay, take some deep breaths. Amber, I see you. Take deep breath, cleansing breaths. Okay. All right, so let's get started here. All right, so let's go through some updates. I just want to bring some things to your attention. So first of all, yesterday, the Department of Health did send out their revisions, their decisions that they made around the COVID guidelines for the community. And as you recall, as of, last May, we've been essentially following these kind of community guidelines for COVID. So they sent out their updates after this. They looked at the CDC changes. They sent out some revisions to it. Not a lot of changes were made. And they sent out this morning, they sent out some revisions to try to provide some more clarification to what they sent out via email yesterday. So that came out as a PDF. So I'm going to send it out to everybody so you can have a document that you can use as a reference and start looking into it, because it's a little hard to answer, or to even ask questions this morning, because some people haven't even really had a chance to look at this and see what it says yet. We certainly will be looking for more kind of tools to use than just a bunch of documents, lengthy documents. So as we get more information, we'll be sharing it out. But for right now, I just wanted to let you know, we will send out the talking points document this morning, and it is dated as of today. So that should be the one to refer to. Okay, so let's look at some of the bills that have been signed, and just some things for you to be thinking about, because for some of these changes, they're really going to be coming into effect next school year, but there are things you can be thinking about now moving forward of how you might look at implementing some of this work. So the first bill I wanted to highlight was Senate Bill 5790. So this one, 5790, had to do with medical equipment in schools. So it talks about a couple of things. It talks about trauma kits, and it talks about AEDs. And many of the districts currently have AEDs. Some funding was actually set aside with the passing of this bill, and that funding was set up because we anticipate there are going to be some districts who might not have an AED. And so some funding has actually been set aside to help with this. So if you're one of those districts who who might have a building who doesn't have AEDs, then keep that in mind, that there will be a mechanism to apply for some support in order to get one if you don't currently have them. Because I know sometimes people might have one, but they really could benefit from another unit. So some funding to help support with AED purchases. The other aspect of this was the bleeding control kits. So in this case, as far as we know right now, there wasn't funding set aside to help with this expense. So these, you know, can vary quite a bit. You're going to want to be looking at what kind of kit you might want to have, because the new law taking effect now, this is 26-27. So you've got time here to think about these things, but you know, you're going to want to have a plan in place for how you would implement this and have it in place by the time that this takes effect. So that would include things like what kits you're going to select, and then the staff training, who's going to be trained in these kits and in the use and techniques involved in responding to traumatic injuries. So as with all of these slides, there's a link so you can read the whole bill. And I would encourage you, when you have time, to look at all of the language in these bills. They're not very lengthy, but still, it gives you an idea of all of the content around what they're trying to what kind of goals and objectives they're trying to meet with these. Okay, 1608. This is another bill that has to do with schools, and it has to do with expanding access to anaphylaxis medications in schools. So as you know, for some of you, it's been really difficult to get a provider to sign off on your orders to have standing epinephrine in your school district. So let's see a show of hands. Who has struggled with that in the past? Getting those orders signed and having some, I know Ben is off right now, but I know there's his hand up, Sarah's hands up. For smaller schools, it has really been an issue, and those in the more rural setting, getting anyone to sign off on those standing epi orders. So this is going to allow the state of Washington to provide a standing order, just like we have standing orders now for naloxone. So an excellent win, a real time saver that we're going to have, but you know, certainly more work now needs to be done to figure out, well, what will this look like, and how will we ensure that everybody has access to these products? Where are they going to come from, and what is the order form going to look like, and how are we going to get them? So this is just an example of the old order form that people used to be using to obtain their epi. And so just to keep an eye out, we will let you know as things progress in this, what are the tools that people are going to use, where should they be, who should they be contacting to get epinephrine, so that you do have those doses available to you if you are in need of them. So that was a big win. That was good. The other one that's really going to be useful for students is the cost reduction bill. So this was House Bill 1979, and it had to do with cost reduction related to both epinephrine as well as inhalers. So one of the issues that people had frequently in the schools is that the students could not get more doses. So oftentimes you talk to the parent about getting another dose, and they'd say, well, you know, we can't get any more because our insurance carrier says they won't provide any more, or there were these other barriers for them getting these doses. And this law is, this was kind of followed, they kind of tried to follow along with the law around reducing the cost of insulin, but this is a little bit different, and it's going to reduces the cost of inhalers and the epi auto injectors, and it also is intended to remove limits on dosing, just for that purpose, so that people can have that extra dose. So if they need it, like in the schools, they wouldn't have any trouble obtaining that. So again, there's a link to the law, and we will be sending out additional information as we have available about that one. Concerning opioid overdose, another huge win now for the schools. So what this bill did, 5804, is expand epinephrine in schools. So, we got rid of the language in the law that talked about in high schools with greater than 2,000 students, the high school was required to have these doses. And now it's saying that it's just opened up. All schools can have access to epi doses and should have naloxone, should have access to naloxone doses. And so the language about the, 2,000 student limit has been removed and has really been opened up for all schools to have access. So that was another big win. The language continues to be in the law that says that certainly we know there's an expense around naloxone. It's running about $40 to $45 a kit right now if you were to buy it in pharmacies. And we're still encouraging districts to reach out and access free resources so that they have naloxone available without having to purchase it through a pharmacy with a standing order. So the law still states if the school district in good faith cannot find any free doses, then they could avoid having to bring it in. But we really want schools to have it, and we want to make sure that they have access to free doses. So any of you, if you're struggling with that, please talk to us so that we can make sure that we get you some that's not going to be a charge to your school. Kind of accompanying that, House Bill 1956 is addressing fentanyl education in schools. And so this House bill was really addressing education. So student education in schools around fentanyl, it needs to be expanded. OSPI and Department of Health are going to be working on new training content that schools will need to be adopting. And you guys could play a huge role in that, in assisting with naloxone training for students and fentanyl education around fentanyl and different types of drugs. So hopefully you have an opportunity to get involved with that with your students. And along with that, while we're talking about fentanyl and talking about naloxone, I did want to make sure you were aware of these training courses. These have been something that the Western Region Counter Drug Training Center has put together, and they're doing them on a pretty regular basis. And so we've got 4 opportunities left here. They've done a couple already. Lena attended one of these, thought it was quite a good program. And so we really want to encourage anyone who would like some additional information about fentanyl, or if you have staff that are interested in this topic, to please encourage them to attend one of these free sessions. These are available by webinar, and the links are here in the PowerPoint, and you can also link to them in the school nurse calendar. Patient Bill of Rights. This one is kind of interesting. So this initiative is 2081, and it's like a Patient Bill of Rights. It's also a Parent Bill of Rights, really, because it's really giving more rights to the parents around access to student information in the school setting. And so I just highlighted a couple of statements out of this bill. We're kind of watching to see if what kind of changes might be brought about by the language that's in this. Most of the feedback that we're getting about this is that it's not taking the place or overriding any of our current laws around access to student information in the school setting. So if there's something that's restricted right now from access, then this would not open that up. But this is kind of one of those vague things that we're still kind of keeping an eye on, and we will get you more information as we hear more about this. Okay, and this House Bill 1230 is something that probably you're going to have some involvement with. And this one actually has been on the books since 2023. It was originally intended to be initiated by this time, and it's still in process. So this is the bill that is requiring school districts to actually provide links to specific information that's put out by the Washington State Department of Health. So the way this would break down is Washington Department of Health would provide information, for example, on a web page that they wanted the public to be able to readily access. So things that are appropriate for parents around K through 12 students should be in a readily available spot. They've been talking about creating a template that people would be able to access quickly from their own school district website. So this shouldn't be something that your school district really needs to spend a lot of time creating. It should be something that is actually delivered or available through the Department of Health that your school district will be readily able to link to. Now, the template hasn't been developed yet, but there is some forward process here. Department of Health, just as of yesterday, said we're putting a group together, and this group is going to provide some input. And that group is made up of some of our public health coordinators across Washington State, some school nurse corps representatives from across the state, to provide some input on their, hopefully a draft that will be soon ready to get out to connect with schools. And we do have support on this from our own media coordinator here at the ESD, who has already been working with school districts in our region. They're already aware of this bill and the need to get this done. We're just waiting on having something ready to go. Okay, so oops. Well, I'm not going to go back because I'm probably going to go back. I'm just going to go forward. Oh, here we go. Cleaning and disinfecting. So just a reminder that this new guidance is out. I just want to make sure that people are aware and that they've had a chance to perhaps print this or save this. If not, you can access it here. Our infectious disease control guide is still not available yet. It's still in process. So I know we've talked about the revisions to that coming, and it continues in process. But this document was revised. And a new radon page has been distributed as well. So again, just something to think about if that's a concern at your school, or if you're involved in any environmental testing, then there's a new webpage out on Department of Health to help you with that. This book, I don't know how many of you have printed this off. As you can see, it's dated 2003. It has not been updated for some time. So it's been on the back burner. It's the OSPI Health and Safety Guide, and it's been revised. So hooray, it's ready to go. It's being launched, and there is a program that has been scheduled by Department of Health. We want to make sure and announce it. It's April 18th, and it will be from 10 to 12. So it is 2 hours. Hopefully it will be recorded. We'll find out more about that as they start, finalizing their plans. But there's a registration process that needs to be done. So on the 18th, if you're available, we encourage you to attend this. And they will go over this brand new manual and the impacts it's going to have on all of us. School and childcare immunization updates. So another update from DOH. And so they are going to provide, Catherine Graff will do an overview for us on the changes that are taking place. And that is going to be on March 28th from 3 to 4 o'clock. And for those of you who have asked, that is going to be recorded. So that session for sure will be a recording. Again, we ask that you pre-register for it, and they'll be going through next year's school year's requirements. So it is a good opportunity to hear the newest on what's coming from the immunization department. Measles resources. So just like with any other communicable disease, we always encourage, if you suspect something, so if you suspect any kind of communicable disease signs and symptoms in some of your students, to please connect as quickly as you can with your health jurisdiction. So please call them, get direction from them. There have been some measles outbreaks, not so much in our area, but we're looking at more of it across the US, and so there is this now attention being paid to what is happening with measles and why are we seeing so much. We do have people who are not vaccinated and then suddenly are having issues with breakouts. So Catherine did send out, and we've already shared these, but things to be thinking about in terms of measles. If something were to happen, things that you need to do to prepare for that, kind of documentation that you need to have in place for staff, for example, if they need to have proof of immunization against measles. So just things to think about. There is a measles resource page for you on the Department of Health website, and the link is right up there at the top of this PowerPoint. So you can get to everything that you might want from measles perspective. EPA, so EPA Monitor Loan Program. This is something new that's we've just become aware of, that is now available in our region. And Sarah's on the line. Sarah in Wilson Creek just recently got one of these purple monitors. So these are little air quality monitors. They are spread throughout the state of Washington, and they're used to track air quality issues and report back to the state as well as to the site who has them about what their air quality is for the day. And so EPA has a little grant program available in which we can get some sites into a loaner program. And so they're looking at, EPA right now is looking at our region to decide where they might need to have an extra monitor placed. And so if your site happens to be one of those areas that they identify is eligible, then we'll be getting in touch with you about the opportunity to get one of these monitors set up. Okay, just a reminder on the district assessment. So the date is coming due. Thank you to everybody who sent them in. We really appreciate it. We're going through them now, and we'll get back to you as you send them in if we have any questions about any of the data. So thank you so much for your work on that. It's really, really appreciated. A couple still presentations, Skyward and Cumulative. If you need help or you want additional training around either of those, there's 2 trainings coming up in April. So please don't hesitate to sign up for one of those, because I think they'll be really helpful for those of you who are relatively new to either Skyward or Cumulative. Okay, training coming up. So just a reminder on the health equity training, because that is a requirement for all of us. So I just want to remind people that it is something that you're going to want to look at and make sure that you have completed before it's time to renew your license by 2026. So that is a requirement. Dish training, we've got the next one scheduled tomorrow, and then monthly through May. And then we'll get into a summer dish program after that time. Our Washington State dish is still looking for feedback. They really appreciate hearing from people about what they're thinking about the dish programs that have gone on. They have a quick survey. And just as a reminder, if you do take this survey, this survey is both for Washington State and for Wisconsin. And so Wisconsin also does a dish program, and the feedback on the survey at one point is asking, hey, what about this program that's coming up on April 17th? Would you like this kind of content? And our content is different in Washington. So we have a different topic on the 17th than the question asks about. So you can just skip through that and it won't apply to you. The other thing I wanted to point out is that the ADA standards on diabetes care were updated in 2024. So if you haven't had a chance to review them, there's a link here. You can get just to the chapter that has to do with child and adolescent diabetes support. It's chapter 14 out of the entire manual, and it's posted in the Google Drive for you, so you can readily access it. Okay, scope and standards, just a reminder about the scope and standards module that's available to people, and encourage you to take that. Also the landscape assessment. So those of you who are involved in data collection might have had a chance, hopefully, to look at this. So a very valuable document that is gives us a much better idea of what's happening with school nursing across the state of Washington. So you can download that. It's available also on the Google Drive. This was a tool for those of you who are able to attend the SNO conference Friday and Saturday. We had a great presentation from a Jurex representative who provided a great presentation on documentation and gave us access to this wonderful little tool called 10 Ways to Avoid Getting Sued, which is a very easy read. It's a wonderful little document, and she sent it to us and gave us permission to post it. So it is also on the Google Drive. It's not so great printed. It is an ebook, but it's relatively, like 10 pages or so. And I would encourage people to take a look at that, and we will be incorporating elements from that in a review of our nursing orientation program as well. So good little tool. Emergency management, just some reminders about these kind of courses, particularly as we look at more, response to trauma in schools, that you guys will want to make sure that you feel really comfortable in regards to trauma response, particularly if you're going to be involved in these types of programs like Stop the Bleed training for staff or other types of trauma response programs that you're going to be involved in staff training. So take a look at these. Many of them are available to you at no charge and are all very good quality programs. Okay, just a couple of things coming up we wanted to make sure you were aware of. If you have any students with disabilities, there is going to be a fair that's scheduled on the 13th of April. And while it is in Wenatchee at the Brave Warrior Project site, it is open to anyone. And so we encourage people who want to find out more about resources. This would be a great place to come and for you to find out about the resources that are available, but certainly for parents of students who might be looking for additional resources for themselves. So that's scheduled on April 13th, and that's going to be in Wenatchee. And then the Chelan County PUD Kids Fest is coming up on May 11th. So those are just some things that you can keep on your calendar of items to post for students. Okay, and with that, I am going to stop sharing and see if anybody has any questions.
Kathy, this is Erica. I have a question.
Yes.
So with the new bill, that we don't have to have like a doctor's order, if I'm correct. Sorry, I've been in and out with kids and stuff, for the EpiPens, and I use the Epi for school, Epi to school. So how do I continue to get my EpiPens through them? Because as of now, I have to have the doctor's
correct. You're absolutely correct. And so what we anticipate we're going to get will be the same type of standing order that we have from the state for naloxone. We will get the same kind of order for EpiPens.
Okay,
so it'll be a signed standing order that you would be able to use to get an EpiPen delivered. What we don't know yet is how that's going to work with that agency where a lot of people get their EpiPens free of charge through them.
Yeah, I did. Yeah, with the doctor's order, and I'll know that we'll need to put in for new ones coming soon, if not this summer. So do you think we'll have the standing order by then, or should I continue to go through the doctor who's more than willing to do it for me?
Well, I think you should do whichever way works best for you, and whatever this is an option for people. If you have a mechanism that already works well for you and you're getting them easily, this wouldn't it doesn't need to replace it. It's really it's really an option because we do have a lot of districts that haven't been able to find anybody to sign for them.
Yeah. Okay, perfect. Thanks.
Welcome. Thanks. Okay, any other questions? If not, I can turn it back over to Lena.
Okay. Again, if you do have any questions that you think of something a little bit later, feel free to just send it on over to us and we'll be happy to get you the answers that you need. So, just a quick screen share with you to remind you about how we're going to do some I just lost the word I was thinking of. To close out the meeting. There we go. Close out the meeting. I just wanted to remind you really quick about our clock hours. So after watching this, and if you're watching it as a recording, so for today, Sheila took attendance for those that attended our Zoom, our live meeting, and we'll be putting that into PD Enroller for you. So if you watch this as a recording, we'll need to have you fill out the little survey form. There's a link on this particular slide, but it's also in the Google Drive, and that will notify us that you've watched it. And then that way we can put it into PD Enroller for you. If you have any questions or concerns, please let us know. Also, I am putting together a feedback form on these meetings. So if you have any suggestions, please feel free to share if there's anything that you would like to share with the group or anything that you'd like to learn about. We would really like to know so that way we can get you the information that you need. That way we can support you in your work with the students that you take care of. So with that, thank you for a great meeting, everyone. We're so grateful for your time and for the presenters that came and spoke to us, but thank you for what you do to support your students and help them every day be healthy and ready to learn.